Hi, in this video, I'm going to be talking about talking with your loved ones if you've been newly diagnosed with breast cancer, or even if you're further along your journey. I'll talk about why you would want to tell people and some ways you can go about doing so to get your needs met and also to keep people included in your circle. Before I go on, I'd love to have you subscribe to our channel. We're always putting out new content. So why would we want to tell people in our life about something as important and serious and potentially private as a breast cancer diagnosis? And these comments apply if there's a change in how things are going during your treatment course as well. Well, social support from people who love us, has been shown to be associated with a host of good outcomes. In some studies, having good social support is actually associated independently with survival. So there's some good medical reasons to enhance the social support around you. It also has been shown that social support can help us tolerate difficult things in our lives in a way that keeps us stronger and safer and more resilient. I want to be really careful with resilience. You are very resilient. Look where you've gotten so far in your life. That's something that we want to protect and nurture in our viewers. So talking to our loved ones, and I'm being really broad about who's in our loved ones, has some good outcomes for you. It also serves as a sort of social glue for your relationships, whether they're strong or whether they might be a little bit rocky. It's important to think about before you go into having these conversations about what level of privacy you would like, what you would like from the people you tell, because they may not know. Even if they've been through something like this, your own journey is different. And the third thing is to remember that even when you don't tell people things, they will know something is going on. So keeping secrets is very difficult. That doesn't mean you have to lay out all your cards on the table and tell people absolutely everything that's going on. You do have a right to privacy, but it's important to realize that when you don't tell, let's say an adolescent child, that something's going on, they're going to know it, and they're going to really worry about it, maybe even more than they will when you actually tell them what's going on. So we've talked about the why. Why would you want social support? And then some additional considerations. The next really big consideration is, who are you going to tell? You might think it's natural that everybody would want to tell their partner. And if your relationship with your partner is not on solid footing, or if they're going through a serious illness, this may not be the first person you think of telling. Because secrets have a way of coming out, however, and filling up a room, unspoken news can fill up a room, it's probably a good thing to think about telling your partner, no matter the status of your relationship, but they may not be the first person that you tell. Your history will help you decide whether or not they should be somebody you tell early on. Other people in your family may be people you feel more comfortable talking about with than your intimate partner. You may have a parent, a sibling, a cousin, or another family member with whom you feel closer and safer talking about something, especially if it's new to you. In terms of telling your children, the way in which and the timing and how you go about deciding when to tell the children depends on their age. We have a whole separate video on this that I would encourage you to watch. But as I mentioned before, it's really hard to keep secrets. You're going to want to decide what types of words to use and how much to tell your children based on their age and your relationship. But we generally don't recommend that you keep all of this away from the children, based on people finding out later and wondering why you didn't trust them, have faith in them, etc., that they could handle the news. Plus, they tend to fill in the gaps when they don't know things and can tell themselves very frightening stories. So we've talked about your partner, other family members, friends. You only really need one close friend to have in your life to feel less lonely. It is very likely that you do not have somebody that you call a close friend right now. We know that there's an epidemic of loneliness, and perhaps your friends have moved away, or something's happened between the two of you, or they're gone due to an illness or something else that happened between you. You may not have a close friend. If that's the case, reach out for support. There are support groups of other people who've been through what you're going or who are going through it right now. A diagnosis of any serious illness can be very isolating, and it's important that you find somebody to share this with. Now, you might tell me your best friend is your mom or your sister, and that's fine. You don't need necessarily to have somebody outside the family. So your best friend may also be in your family, and that's wonderful. What about your coworkers or other people in the community, your neighbor, people at church? As you think about the other people in your circle and your widening circle, I would encourage you to practice some discretion, especially before you know what the plan is. It's not that this is shameful or has to stay private, but you will find that when you tell somebody with whom you're not that close, they will start to tell other people with whom you are also not that close, even if you ask them not to. Even if you say, please don't tell other people, this is like a burning thing inside them, and they will want to seek some relief from holding that secret themselves. So, my father always told me, oh, I tell people it's not you I worry about, it's all the people you tell. Because we know that the person who says they can be trusted are very likely to share that with somebody else. And then at that point, you can't control the message. And if you're not sure yet what the plan is or the prognosis, now things can get a little out of control and it's hard to take it back. Again, I'm not saying don't tell people ever. Just decide whom you're going to tell. And even when you ask people not to tell other people, be aware that they will. It's just human nature to want to share both good news and news that's more concerning. Then your coworkers are a separate circle. When you tell people at work, and frankly, no matter who you tell, the first thing on their mind is, what does this mean for me? So if you tell a child, they're going to wonder, and I mean an adult child, they're going to wonder, am I going to get this? And it's just natural. It doesn't mean they're being selfish. There may be parts of them that are selfish, but it is natural for people at work to wonder, what's this going to mean for me in terms of workload and how we're going to manage without this person who's very important to us. So there's a lot of circles to think about. There are people who are trained in confidentiality. Your therapist, your doctors, lay ministers in your church, people in your synagogue are trained to respect confidentiality. Support group leaders, social workers, these are people to think about bringing in first. So I've talked about why, and then I've talked about the whom. What about the next steps? How do we actually make this happen? Well, the next thing to think about is the where and the when. And I'm just going to give some general tips. You'll let me know in the comments how this worked for you, how you went about doing this. It depends awfully a lot on the relationship itself. But in general, try not to overwhelm yourself with a large number of people unless you want to be the person telling everybody. So it depends on the size and the nature of your family or your friends' circle. But you may find yourself overwhelmed by the emotions of a lot of people if you have a very large family, for example, or a large friend group. And think about and actually imagine what it will be like to tell people in a larger group versus a smaller group. So how are you going to go about doing this? I recommend that you not do it when you've just come from a doctor's appointment or when you're just about to have another test or you've just had a test and you don't know the result. Wait till you're as fully resourced as you can. So you're well rested, you've had a meal, you're feeling good physically, and then you know that your tank is full and you're able to handle all those emotions and questions and thoughts and feelings that are going to be coming up when you tell other people that you're about to tell. And then in terms of where, if you're expecting a huge emotional outburst, you may want to tell people in a more public setting where people are going to be on their best behavior. But in general, telling people in a space where it's quiet and you won't be interrupted can actually be much more helpful. Again, these are just general tips. Every single person is different, but these are some things to think about as you plan how you're going to tell other people. And then the what. What are you going to tell people? Try not to dance around it or you're going to freak everybody out. Try to be as direct as possible. For example, something along the lines of, I was recently diagnosed with breast cancer. This is what I know, and this is what I'm waiting to find out, and this is the plan. But you do need to stop. Like, think about when you went to see the doctor and they told you, we tend to tell people too much. The best way to hear news of any sort is in smaller batches. So you might want to say, I've recently found out that I have breast cancer. It's stage, whatever stage it is. This is what I know. And then just stop and wait. People will need a moment for that to land, just like you did when you were told. And then you can see if anybody has any questions, and then you tell them the next batch of information. They're likely to ask questions that you're planning on answering in a moment. That's okay. You can just tell them, I'll get to that in a moment. And then you can tell them more details about what you know. If there are things you're still waiting on, I would, before you even talk about the plan, say, these are the things I'm waiting on, the tests I need to have, the things I'm going to be hearing, the appointments that need to be set up. And you can, of course, organize this all before you start the conversation. And then the next batch of information, if you will be what the plan is. And that might be answering some of those things you don't already know. I know this is a lot, right? It was a lot to hear, and now you're going to be sharing it. One thing that you can do is you can say to your medical team, I'm going to be having a conversation with my family or my friends or at work. This is what I'm going to tell them. Am I telling them too much? Am I telling them too little? What did I get wrong? That's a great way for us to understand what it is you know and what holes we might need to go back and be clearer about. And also to say, well, that might be more of a technicality, or we don't actually know that yet. This is a big test, you can say, is going to be coming up, or you need to see the plastic surgeon before you know what kind of plastic surgery you're going to have, for example. In general, I think that less is more. So if you plan on talking for 30 or 45 minutes, that's probably too much. You are going to want to read the people around you. You're going to start to see that they may become overwhelmed with emotion. They may get distant. They may be afraid. These are all feelings you've had, and the people who love you are going to have a very similar set of feelings. They may lean towards anger. If only that doctor had such and such, this wouldn't have happened. Or if only you hadn't, that's the worst. If only you hadn't done such and such, this wouldn't have happened. They're just angry and they're scared. Most of these very strong emotions really are a stand-in for fear. And this is one reason you want to go in really well-resourced, so you can just be as calm as you can as you share the information. If there are people that you think are going to react in a way that's blaming or shaming, I think you may want to have somebody else break the news to them, and you can tell them the parameters, what you want included in that conversation or not. You're going through a lot of emotions yourself, and I'm just telling you all the other emotions people around you are going to have. You kind of know what's coming because you know your people. So I just want to urge you to protect yourself and to anticipate or expect what's coming so that you can better protect yourself. And then what about the after? after you've told everybody, are you open for questions? You might not be. You might be like one of our Congress people who says, I'm not taking any questions. Or you may be really open for questions. One thing that's really helpful is to say, this is what I need. I need you to be here for me. I need you just to listen. You also can tell them what's not helpful. Sometimes it's really helpful to hear everything's going to be okay. And for some of us, that's not helpful at all, especially if you're early on and there are a lot of things you don't know. That might actually sound like they're taking care of themselves, right? It's going to be okay. It's going to be okay. It's going to be okay. And they're telling themselves that and not you. So it's really okay before this conversation even starts to say, I'm going to tell you some news about myself. And this is what I really need. I need you to listen. I need you to write down any questions you have. I need you not to reassure me. I need you to reassure me. I don't want to be touched. I do want you just to sit and hold my hand. People don't know, and you know what? They're going to do it wrong. So if you know yourself well enough to know what you want from them, do everybody a favor and just tell them. I have covered a lot in this video. I hope it's been helpful. Drop us a comment or a question below. While we can't give specific medical advice, we can share what we know from lots of other people who've gone through similar things. And your sharing your story helps the Yerbba community. Don't forget to subscribe to our channel, and thanks for watching.